Anti-personality disorder, also called ASPD. What it is: antisocial personality disorder is a mental condition in which a person has a long-term pattern of manipulating, exploiting, or violating the rights of others and without any remorse. This behavior may cause problems in relationships or at work and is often criminal. A majority of the people who suffer from this are unlikely to believe they need to seek help. It is also referred to as a lunatic, maniac, psycho, sociopath, or psychotic. Symptoms of APD include aggression, irresponsibility, impulsivity, lack of regard for other people's emotions, and not caring about consequences. How do you know if you suffer from this? Diagnosis is typically based on a psychological evaluation that explores thoughts, feelings, relationships, behavioral patterns, and family history, personal and medical history. Cause of this disorder is unknown. A person's genes and other factors, such as child abuse, may contribute to developing this condition. People with an antisocial or alcoholic parent are at an increased risk. Far more men than women are affected. Though the disorder isn't diagnosed before age 18, some signs and symptoms may occur in childhood or the early teen years. Usually there is evidence of conduct disorder symptoms before age 15. Identifying the disorder early may help improve long-term outcomes. There is no cure for antisocial personality disorder, but treatment can help a person control their symptoms. There is limited research on the effectiveness of treatment for antisocial personality disorder, and what works for one person might not work for another. Therapy may include anger and violence management, treatment for substance abuse, and treatment for other mental health conditions. Treatment may include psychotherapy, also called talk therapy. Treatment depends on each person's particular situation, their willingness to participate in treatment, and the severity of symptoms. Someone who suffered from this disorder was Theodore Bundy. He was an American serial killer, kidnapper, rapist, burglar, necrophile, and sociopath who assaulted and murdered numerous young women and girls during the 1970s. While experts found Bundy's precise diagnosis elusive, the majority of evidence pointed away from bipolar disorder or other psychosis and toward antisocial personality disorder. Bundy displayed many personality traits typically found in ASPD patients, with little true personality or genuine insight beneath the facade, such as outward charm and charisma, the ability to distinguish right from wrong but with minimal effect on behavior, and an absence of guilt or remorse. Guilt doesn't solve anything really, Bundy said in 1981. It hurts you, and I guess I'm in the enviable position of not having to deal with guilt.